Resume the recording. Here we go. So we're going to talk about your city provided benefits, your welfare fund benefits, how you convert the benefits you have as an active employee to a retiree benefit, how some of the retiree benefits change, what costs are associated with it, some of the more common situations of who covers who and how. If anybody is close to being mature, which is around our fund is age 65, then you've got some Medicare related issues to think about as you get ready to retire. There's always the issues of what do you do with TRS and the Department of Education. So what I'm going to do is I'm going to talk for a while. I'm going to put on the screen the materials that I emailed you, because that way I remember what I'm supposed to talk about. I'll stop every little bit and ask if you have questions. If you have questions, probably the best way through the main part of the presentation is to post them in the chat. At the end, if you have individual questions that you're not ashamed to hear other people know that you have the questions, we can answer them here, or we can talk offline in the next few days or weeks and see what's going on. So I'm going to get the screen up here. Look at that, it actually works. So these are the materials that I emailed you, the materials we would have handed out. And the first couple of sheets here are just a reminder for me and some general things to remind you what's important. The most important thing in the whole process, other than you being ready to retire mentally, is that you have your pension consultation. The CSA union will reimburse you for up to 3 pension consultations. One, there needs to be 12 months between them. You just contact the union, say you want a pension voucher, and you have your consultation with the consultant, get a receipt from them, put it with the voucher, send it back, and CSA will send you a check for $150. If you're a member of NYSESPA, the Elementary School Principals Association, they will provide a 4th consultation so that you have 4 that you can get reimbursed for. If after 3 or 4 you still have questions, my advice is have the 5th consultation or the 6th, because this is setting you up for the next major section of your life, and you want to make sure you make the correct financial decisions. I do not do pensions. I do not give pension advice. I do not give investment advice. When I first went in the welfare fund pension system, within 2 weeks, I lost $500. So you don't want to have the same choices I do when it comes to picking investments. I did join during the dot-com bubble, so that's my excuse. But you still want to be able to know that you're making the right decision and you have the right option to leave something for a spouse or partner who may have some financial needs afterwards. When you're ready to retire, you've had the consultation, the next step is to go and file the papers with TRS. In the good old days, this would be a 15-minute walk over to Water Street and hand in the papers. But now, because everybody's closed to walk-ins, they need to do it online. One advantage of this is you don't have to get anything notarized anymore. So you'll meet with your pension consultant. The pension consultant will advise you how to fill out the forms. You'll go on to the website down here to submit your paperwork. And go to the TRS website. They have instructions on how to do the initial part. Within a couple of 3 days, you'll get an email saying that they have the documents. Then they will arrange, someone will call you personally to go over them. And when everything's all said and done, you will get the receipt. The receipt looks something like this here. And what's important on here is it shows you the retirement date. So this is the date you no longer are an active employee for the city. That's the day your retirement starts. That's the day the healthcare switches over to retiree status. That's when the welfare fund benefits switch to retiree status. and it's when you drop off payroll. So you're no longer getting a check as an active member.
So if we're retiring at the end of this year, our date is 7/1/2021?
At the end of the school year, yes.
Okay.
Yeah, right. Now, TRS will take the documents 90 days in advance. Because everything's being done online these days, I encourage you to be, especially if you're retiring, at the end of the school year, do this as soon as possible after, at the 90 days, do it at day 89. Because you need to be able to get the TRS receipt back before you go to the next step. And the next step is to submit the health benefits application, which we have here, onto the Department of Ed. Yeah, you got a question, Stephanie?
Yes, Doug. Is there any benefit to staying on until September 1st, or July is the best?
I would talk to your pension consultant about that.
Got it. Thank you.
Some people say there is, some that don't. I'm not going to give you the advice because I don't want to be wrong. I'm wrong enough of the time.
I have a question.
Okay.
I had a consultation in 2019 at the end of the year.
Okay.
Is that still good?
What you had the consultation?
Yes, I did. It was a fourth consultation. So can I still, there was no retirement date on it. So can I still put those papers in?
If you like, you might, I would suggest that you contact whoever you had as a consultant, and maybe just make sure that nothing has changed, to make sure you do it the right way. I'm just concerned that, I know my situation changes from year to year. And I would hate to be the one to say, take advice that they gave you 2 years ago, and now 2 years later, maybe something's changed.
Okay.
If you've had multiple consultations with the same person, they may be willing to just answer a question for you.
Okay. Okay, thank you.
I'm just very apprehensive. I don't want you to hate me. I got enough people hate me already. But it's more for your protection. I know you've had the 3 or 4 consultations and it's an expense, but just to make sure.
Right.
And if you are thinking of retiring at the end of the school year, it's not too early to schedule that consultation now, because they will book up incredibly, because they're all doing it virtual too.
And then how do we submit our papers? Or I called CSA and they couldn't give me an answer.
What this TRS papers? Well, that was the first thing here.
Okay.
There's a document here, and if you go to the TRS website, there'll be forms to fill out online rather than the paperwork, and then anything else you'll be able to upload. I didn't go on that link. It looks like a frequently asked questions, so they'll have more information there for you on how to do it. My understanding is that what used to be documents are now screens to fill in, so they get the same information that was on the form you may have had with the pension consultant. And then, they go from there. Am I wrong, Mr. Guru?
No, you're exactly right. A quick question, Doug. Is there a deadline for submitting that health benefits application?
The earlier you do it, the better, because the day you retire, you lose health coverage technically.
Gotcha.
And so, because City of New York employees and retirees are eligible for free health care as long as they're either getting a paycheck or a pension check.
Right.
And there's a couple of months delay before they finalize your pension. So if they have the documents in the TRS receipt, they'll extend the health care benefits. And unfortunately, health and welfare is running a couple of weeks lag time now. So if you sent them the documents today, they may not get to them until the 1st of February.
Gotcha.
And then once they go to them, then it gets fed over to Office of Labor Relations, which does what they do, that they feed it to the insurance company. So it's normally if you walk in, hand them the paper, you're done. But because everything's online now.
Gotcha. Thank you.
Okay.
Pardon me. How do we
Yeah.
get a listing of consultants? I've tried to ask a couple of times, but how do we find consultants?
Email me and I'll see if I can find you a couple, find out where you are. CSA years ago, way back, before any of you were even teachers maybe, had some on staff. Then they were concerned that they would be liable for the information the consultant gave. So then they had participating consultants. And then somebody said, well, what about if by having it as participating, you're endorsing them? So now they don't endorse anybody. You can go to anybody, but there are a number that have, that are retired CSA members who are very good. And, if you email me, I can give you a couple of who they are.
Thank you very much.
Okay. Okay, there's another question here, Suzanne.
Yeah, I have a question.
Okay,
I want to, well, my retirement date is 2024. And
okay.
my understanding, you have to retire. When do you start the process? Should I start it in 2023?
When in 24 are you looking to retire?
Well, I want to be done by June.
June of 24?
Yes.
You can start it this time in 24. That's not a problem. If you haven't had the pension consultation yet, have one now.
Mm-hmm.
And then, because they'll tell you, yes, that's legit, that's doable to retire in 24, or, you really should go a couple more years for whatever reason.
Oh, no, I'm done. 36 years, I'm done.
That's your decision, but I'm saying that, the general idea is you have one around the time you turn 50 before you might be able to retire, and then use the other two as you get closer to make sure you're on track.
Okay, gotcha.
Yeah, but if you've already had one, or if you haven't had one, it wouldn't hurt to schedule one now.
No, I haven't had it. That's why.
Huh? You haven't?
No, I still have the voucher. I have to
Okay.
find it.
Okay, great. So if you had one now,
Mm-hmm.
it's not time sensitive. If you don't get it until, whenever, that's fine. It just gives you an idea of what your status is and that the June 2024 is going to work. And
Right.
then when you get to either the end of December of 23 or January of 24, then you go and start get the final consultation, get all the paperwork together. Beginning of April of 24, then you start submitting documents, or hopefully by then we can walk into places and do it.
Right.
And then everything's in place for an orderly transition on July 1st.
Okay, got it. Thank you so
Okay.
much.
My pleasure. Okay, so that's TRS. Now we get to the best one, not the best one, but the other one. In order to transfer your health benefits to a retiree status, you need the TRS receipt that you're going to get from the first step. And then you also have to do a health benefits application, which we have in here, which goes to the Department of Health and Welfare. What happens is they have to certify that you're eligible for retirement. That's what's on the bottom of the health benefits form, is the area for a payroll secretary or or the Department of Health and Welfare to certify that. The city needs to have it go through the agency because that's where your employment records are. So they put in, when do you start? When did you end? If you got at least 10 years of service to the city of New York, yes, good, you're qualified for healthcare. That's why this is the next step. And the DOE won't process your application for retiree benefits unless they see the actual date that you're retiring. So that's why the TRS receipt is so important. So you would take the health benefits form, the TRS receipt, and then I just saw a typo there. Nobody saw that all spring. Wonderful. What we'd like to do is look at your health benefits application before you send it to DOE. So if you would send it to enrollment@csawf.org, or since there won't be as many this time, if you email it to me, dhathaway@csawf.org. We'll look at the form, make sure it's filled out correctly. when it's filled out correctly, then you can submit using the link here on the bottom to the Department of Ed, Health and Welfare, the HR Connect Benefax at schools. I say send it to us first because it's not unusual for you to make a mistake on the form. Send it to, submit it by email to the DOE. They'll send you back, yes, it's case number. And then 2 or 3 weeks later, they'll say, your application was rejected because of the following reason. There is no reason specified. So if we look at it ahead of time with you, then hopefully we can make sure that you've done it correctly, catch the errors or any questions there might be beforehand, and then send it over to the city.
Doug,
Again,
what's your email again?
D
Hathaway?
D Hathaway,
Yes,
yeah, Hathaway at csawf.org.
thank you.
So,
Doug,
yeah,
I just have a quick question about the health benefits.
right.
So I'm retiring, say, I'm retiring out from CSA in 2022, and say I have my spouse who's
Right.
going to retire from UFT the following year or 2 years after that.
Mhm.
Is it beneficial for me to stay under him, or like what would be the
Yeah.
best?
Good question. So if your spouse or partner is also a city employee, when you retire, it's advantageous to become dependent on the one who remains in service for health benefits, because the big thing you're looking to save money on is the optional benefits, which is prescriptions. So if your spouse is a UFT member and it's going to continue to work, then you'll be covered by the retiree welfare fund. You and any dependent children will go under his coverage, and your drugs will come from the UFT. When he retires, if there are no dependent children still hanging around, then the recommendation is that you split coverage and you each have your own coverage. Because there's no incentive really to have family coverage if there's only 2 people. And you're each allowed to have your own coverage. And what more, not to be morbid about it, but if your coverage is on your spouse's, if you're his dependent, and by chance he predeceases you, you're without coverage until you go back to labor relations and get your own coverage. So the day your husband would die or spouse would die, all benefits would end, drugs, everything, through the city, and you wouldn't be able to have any drugs to get through, help you sleep. So now, if you've got your own coverage, you each keep your own benefits. And it's one less thing to deal with when you're dealing with everything else.
Right, okay, thank you so much.
Right, no problem. So, and that's something that we will help you work with, because in that situation, in her situation, does he have coverage as well, or is he on your coverage now?
We're on, everything's on right now.
Everything's on you. Okay. Then what he would do is you have to go through the DOE, and he would have to pick up coverage for everybody. You do a form saying you're going to waive your coverage, and then it was.
Mr. Hathaway, someone needs to mute their phones or something, because I can't
please
hear.
mute, guys. I didn't know I was dealing with other fund administrators. We do a monthly meeting with the city and the fund administrators, who are hearing everybody's calls, even after this many months. But thank you for the muting. Let's see.
Doug, I'm sorry, I want to clarify. So everyone's
Okay.
under me because I am the older one. So we would have to change over prior to me retiring.
Yeah.
Is that correct?
Right, that would be part of the retirement process. Is he would file a form reinstating his benefits, which means he would file the form. He'd have to file a marriage certificate, copy of a tax return, copy of a mortgage statement, just as if you were first coming in and getting married, and birth certificates of the kids, because even though they're all under you now, it's under him, and they don't have a record of him having a family. So it's just part of the the bureaucracy that we have to deal with, and you know,
Thank you.
we have contacts here that we can work with if need be.
Thank you.
Okay, so this is what the health benefits form looks like. 20 years ago, I'd go through each field, but I'd fall asleep after a while.
From time, open the door.
The door is open, it's not locked. But I'm gonna come down there, but the door is not locked.
Have to mute.
I got her. So, you know, this form could be used for a variety of purposes. You check your employee, check that you're going to be retiring. You want to say yes to the add optional benefits because the retiree welfare fund does not provide prescription drug benefit. I've got the benefit chart here is the next one, I believe. So this is what the health benefit form looks like. Down here at the bottom in box J is where the DOE has to certify it. So that's why it has to go to them. Then there's instructions.
Excuse me, Doug, I have a question.
Yep.
Hi, so you said that the retiree fund does not provide prescription benefits. Isn't there something where we are reimbursed?
Yes, we'll talk about it. We reimburse copays. If you look here on page 11 of the materials I handed out, I've got the current pension deductions for healthcare. So if you're not yet Medicare eligible, which means you're under 65, the first set of numbers, individual is the first, then the family. You go over. If you're a GHI, an individual deduction is $83.91. The family deduction is $152.69. If you're in HIP, it's the one or the other two, either the newer plan or the old grandfather's plan. You see the pension deductions there. When you get to be Medicare eligible, which is 65, then it's a per person coverage. And this year it's $150.30 for the prescription drugs. The rider other is extended hospital benefit that the welfare fund picks up. So that's your cost for a married couple. Medicare eligible is $300 a month. For a family in the GHI CBP, it's $152.59 a month. That would come directly out of your pension, starting from when they finalize the pension, and you'd be good to go.
And then is a certain amount of that reimbursed through the welfare fund?
Yeah, at the end of what happens is you'll be getting your prescriptions through Express Scripts if you're in GHI or HIP. You should get a quarterly report for everybody you're covering for what your drug use was. So we ask you to save those up till the end of the year, send us photocopies. We will look at it. We'll take $100 deductible and give you back 80% of the difference. If you're a member of the retiree chapter, which I'll talk about here in a second, then you'll get another 20% from them. So you join the retiree chapter, you're in the retiree welfare fund, pre-Medicare, $96 of every 100 you spend on prescriptions is reimbursed to you. And we'll talk in depth about all the welfare fund benefits here in a little bit. Let's see, do we have any? See, I don't like this. Let me just stop sharing this for a second. See, oh, we got some questions. Okay. When I'm sharing, I don't see questions. I'm sorry. So let's see what we got here. Okay, we got that. Just a lot of pension consultant chatter. Good. Okay, I told you my email. Okay, retiree dues. Okay, retiree dues. Welfare fund is free of charge for you and your eligible dependents. Part of what's negotiated while you're active employees is a contribution to both the active welfare fund and the retiree welfare fund. So in essence, while you're working now, you're putting money aside so that you can have benefits as a retiree. The retiree chapter is a different situation. The retiree chapter is a way to continue membership in the union once you've retired. You would pay dues for that. If you join as an individual, the dues are 0.0035 times your monthly gross pension. If you join with a spouse or partner, it's 0.0045%, so just a little bit more. Typically, it's around $30 a month. I have a comparison chart here which lists all the benefits and things you get for that. The other thing, or the most important thing, is that you maintain support of the union that got you the nice retirement you're going to have. When the union leaders go to Albany or to City Hall, they don't say we've got 6,000 retirees and 6,000 actives. They'll say I represent 12,000, 13, 15,000, whatever members. And so it helps the union advocate for us to make sure that the city doesn't do anything with retiree benefits, to make sure the state doesn't start doing something stupid like taxing pensions, and a number of things. There's also an extensive educational and cultural program. Everything now is on Zoom, so you can just, in the comfort of your own home, take part. When we're able to meet again, they have a number of meetings in our office. They'll do walking tours, they'll do behind the scenes tours. They've done Broadway, they've done Yankee Stadium, they've done Citi Field. They've got dining clubs, they've got movie clubs, they've got book clubs, they've got drinking clubs, none of which they invite me to. And then if you decide to leave New York, in a number of the other areas around the country where CSA retirees have congregated, there are what we call regional units, and there's about 16 or 17 of them now. There's 3 in Florida, there's Arizona, California, Georgia, the Carolinas, all 5 boroughs in New York, Long Island, Westchester, Rockland, Orange, Bergen County, Northern Jersey, Central Jersey, and the newest one is, I guess, was Mid-Atlantic around Washington, D.C., with an even newer one starting up in Central Florida, up around Orlando.
Anything
So-
international?
Huh?
Anything international?
No, nothing international yet.
I'll start it.
Yeah, you started. And I'll come and talk to you every year. I miss my trips to Florida. I should have been in Florida last week talking to retirees, but it was cold there last week, so I was just as glad to be doing it from the comfort of my study. So that's the retiree chapter.
All right, so just to clarify, the welfare fund membership is free for us and a spouse or partner. The retiree chapter for us is what we would pay the membership
Right,
dues
yes.
for. And that would be 0.0045% of the gross pension for
Right.
us and a spouse. Okay,
Right, yep, for you and the spouse, right.
thank you.
Okay, so we've got another one here. If you plan to retire February 22, when should you start the paperwork? Probably December, beginning of December of this year, 21. Hopefully hopefully you'll be able to walk in by then, which would make things a lot easier because it's usually just the morning. But if you can't walk in, then the 90 days will be plenty of time to do that.
Thank you.
Okay. Or actually, if it's February 1st, you probably could start in November.
Okay. Thank
Okay.
you.
What happens if you want to retire this year? You start the paperwork now?
When are you looking to retire?
June.
Okay, if you're looking to retire in June, it's not too early to schedule a final pension consultation. because they may not just be able to walk in, I haven't spoken to them lately, but they will start filling up very soon. And, if you see them in February or March, not much is going to change between then and June. So then by the beginning of April, you can start contacting TRS to get the paperwork and the receipt there. And then you can go and once you get the TRS receipt, you can submit the documents to us for review, the health benefits form, and then send that over to the Department of Ed. So,
Thank you.
that you can start actually submitting paperwork 90 days in advance, but to get the pension consultation and knowing how busy they get, the closer it gets to July 1st, it's not too early to go and start, arranging for a second or for a consultation now.
Thank you.
Okay. Okay, let's go back to the screen. The other thing, since our welfare fund is a separate fund, a completely separate fund, we do need a retiree welfare fund enrollment form. So when you're sending paperwork to us to review for DOE, please complete this form as well. You will not have a pension number until well after you've retired, so you can leave that one blank if you like. And we're just asking here for pretty much the same information, but because it's a separate fund, we need to have updated information on you. And this form and the health benefits form are available on our website. The next one here is sort of like my favorite one because this shows the benefits that we enjoy as CSA members. And it's my attempt to be a graphic artist, so apologies in advance. But the underlying foundation of everything that we have is our city-provided health plan. It's in the city charter that the city of New York provides free basic health care for all of its active and retired members, employees, and their eligible dependents. So this is not something that one mayor likes, one mayor doesn't. This is in the city charter. There would need to be a charter revision, which they've tried. It's been unsuccessful the last few times, but it would have to do that. Of course, the city bases their contributions on the cheapest plan around, which historically has been HIP, the HIP HMO. So the city provides every health plan that was on that rate chart, whatever the HIP rate is, and then they allow some plans to charge more, like Aetna, Cigna, Blue Cross. They say that their doctors won't work for what the city is willing to pay, so the city allows them to charge some extra. But you do have the free basic health care. There are things that no city plan covers. One thing that no city plan covers is prescription drugs. So the welfare fund for active employees provides a prescription drug benefit. Unfortunately, we don't have the resources to do it for retirees, so that's why you would pay for that. The welfare fund benefits also are benefits that the city doesn't provide. The city doesn't provide dental care. The city doesn't provide hearing aids and vision care. The city doesn't do a lot with reimbursing for major expenses or things. So that's where the welfare fund comes in. As long as you're a participant in our CSA active welfare fund when you retire, then you'll be automatically eligible for coverage by the retiree welfare fund. So if you're not yet close to retirement age and somebody offers you a chance to become a deputy superintendent or a management position, pardon me, you have the option.
We're losing you, Doug. I think you were frozen. We can't hear you.
Can you hear me now? Okay. Okay, let me just pause it. Let me mute myself for a second. I feel a sinus cough coming. Okay, sorry about that. So I was saying is if you get promoted to a management position, you have the option to stay in the CSA welfare fund. If not, you go into something called the management benefit fund. The management benefit fund is similar. Their benefits are not as good as our active fund. The retiree benefits are far inferior to what we provide for retirees. So if you get the opportunity at the end of your career to be promoted, to take a management position, please tell them you want to continue in the CSA active welfare fund. If you opt out and then retire from that management position, there's no way for us to get you back into the retiree welfare fund. You're in whatever fund you're in when you retire. And like I said, this comes free of charge. Part of the negotiation is provided this. And on top, what you pay for is the CSA retiree chapter. So you got 3 levels. When you get to be Medicare eligible, it gets even better, because underlying everything is Medicare. Medicare becomes the primary coverage. Your city coverage automatically becomes a Medicare supplement that you do not pay for. And then you have the welfare fund and the retiree chapter on top. So again, you see the rate charts here. If you're GHI, the basic coverage, you don't pay anything for, GHI and HIP. If you decide you want to be in the Aetna EPO, the basic coverage costs you $368 a month for an individual, $1,500 for a family. As a retiree, you'll need a prescription plan. For an individual, the prescription plan with Aetna is $1,835 a month. For a family, it's $5,100 a month. $6,700 for a family coverage in Aetna is probably close to what the pension's going to be. So we don't, we still have some in there. When they see the cost, then they decide to change to something less expensive. So these are the rate charts. The next thing here is just some.
Can I ask a
yeah,
question, sir? Can you change your health plan after retirement?
you can change your health plan every other year once you retire. So
Because I currently have HIP, but I want to change to GHI upon retirement.
Okay, when are you planning to retire?
At the end of the summer.
Oh, okay. You probably will have to be in HIP for 1.5 years. The plan you're in now is the plan you have to be in when you retire. If you had changed last October to GHI, then you'd be in GHI when you retired this summer. And the transfer period for retirees is every other year. We just had one in 2020. The next one won't be till 22.
Okay.
Okay.
Thanks.
So if you're thinking about changing, anybody else, and you're not retiring this year, if you're going to retire next year, then you can make the change now as an active member, and then whatever plan you're in when you're an active member, you're in the retiree, in that same plan as a retiree.
Change period is in October.
The transfer period for active members is October every year. For retirees, it's every other year in November. So we just had one in November 2020. The next one will be November 22.
Thank you.
Okay. The next little bit here is just some, for reference, some FAQs from the city over who to contact, when to contact, why to contact. Then we've got our little piece on long-term care. Long-term care, nursing home care. That is something that no benefits that you're actually going to get now have. Medicare doesn't have long-term care. The city coverage doesn't have it. Welfare fund doesn't provide it. Based upon pensions alone, the income level will be too high to qualify for Medicaid. so New York State won't cover it. A year in a nursing home in Greater New York can easily be $200,000 per person, probably with a roommate, not of your choice. So long-term care is something to look at. If you haven't gotten it yet, it's never cheaper than it is now. The premiums are based upon your age when you enroll in the plan and when you're accepted into the plan. So if you get it at age 50, it's cheaper than when you get it at 60, because they've got 10 more years to collect the premium from you. The union has endorsed a couple of plans. If you log into the CSA website and go into the member benefits section, you can go to the box there for long-term care. Our representative is a woman by the name of Ellie Packer. Her contact information is there. She's excellent. There are 2 plans CSA has endorsed. And if those don't work for you, she can help you find another plan at a discount. But it's something worth looking into if you haven't got it yet. If you still have the catastrophic medical you may have gotten through NYSET when you were a teacher, through originally Wohlers, then Seabury and Smith, then Marsh, that provides a little bit of coverage, but it doesn't provide full nursing home coverage. So we put this in, it's a disclaimer maybe, but something that you should consider if you don't have it. And if you have questions, you can always contact me, and we can I can get you in contact with Ellie if you're having trouble, or we can talk about what other type of things you might want to look for. The next thing here is an assignment I'm going to give you. One of the things that my staff and I deal with, and the staff in the retiree chapter deal with, are new surviving spouses. And what we typically get from the new surviving spouse is, what do I do? He or she did everything. I have no idea what's going on. What do you mean? What's a TDA? What's a pension option? So what we did in conjunction with the retiree chapter was put together like a resource guide. If this is what you want to look at, provide this information, put it someplace where it's helpful, where you know where it is, where your spouse or partner know where it is, where your family knows where it is, and it will help them go through things after you would pass. The first thing, of course, is you would need to notify the pension system, teachers' retirement system. They're incredibly slow, and so that wants to be the first one. They're going to require the original death certificate. You let them know, you file the documents. What they will do is they'll go back and they'll recalculate your pension for the month you passed away, and then figure out what it should be for your survivors going forward. Now, why this is important is if you pass away in the middle of the month and they pay you at the end of that month, then they've paid you incorrectly. So what they will do is claw back the money for any money that was paid incorrectly. If your survivors wait 6 months, they're going to try to get 6 months of pension back. Because what they have to do is recalculate the pension for that month that you pass, 15 days with you alive, 15 days with you deceased. And it takes them a couple of 3 months to do this. So the sooner they're aware of it and we get the paperwork to them, then the sooner they can start it and get going on and get things straightened out. The second group that needs to be notified is the City Department of Labor Relations, because they control the health care. Remember I said before that when you stop being an active member, your health benefits die. Well, when you pass away, your health benefits die with you. So any partner or spouse who's on your coverage needs to arrange for COBRA. We suggest you go to their website, but if you call them, you'll have to be on hold for 3.5 hours, then the phone line goes dead. So you can just call us instead, and we will expedite that for you. We have contacts with labor relations and all the insurance companies. Third is Social Security. You need to let Social Security know. Usually funeral homes, the funeral directors will do this, but it doesn't hurt to let them know, because incorrectly collecting Social Security on someone who's deceased is a felony, probably. If it isn't, it should be. I live out in Nassau County here, and several years ago, there was something in the paper where a guy in Queens, his father was at North Shore Hospital right over the border, and passed away. And so this darling, wonderful son let his father's body sit in the morgue for a year, and he continued to collect his Social Security. So when they finally realized it, they took back the Social Security money and they put the son in jail for Social Security fraud. There was a case of Florida with the state retiree system where survivors kept a retired state retiree alive for 8 years just by sending back all the paperwork when it came. Not a good idea. Let Social Security know. They provide some minimal death benefit, and perhaps if you had military service, they can arrange a military presence at the funeral. The more important ones are here: the retiree chapter and the welfare fund. We will walk you through that. If your survivor wishes to remain a member of the retiree chapter, they'll arrange for the billing. We provide survivor benefits without cost for 5 years, and we can send a survivor information packet out and make sure that we do that. We will also help those who leave behind deal with adjusting to the insurance, getting the COBRA with the city filed out, letting the city know, doing whatever we need to do to make sure anything that is due to you gets reimbursed. And then the rest of this is information about you, date of birth.
I'm sorry,
yeah.
Doug, can you just repeat that? What, if your spouse survives you, what does the CSA provide for 5 years?
The welfare fund benefits.
Okay, thank you.
Welfare fund benefits free for 5 years. And after that, they can purchase it on the COBRA. This year, it's about $65 a month. And it's all retiree welfare fund benefits at that cost. And we'll show you the benefits here in a little bit. So the rest of this is date of birth. What's the real date of birth, not the one you told everybody. Place of birth, where's your birth certificate. Pension number, TDA number, pension TDA options, beneficiaries. Other organizations that might have a death benefit, a credit union, college alumni association or something. Where's the original copy of the will? Who's the attorney? Tax papers, who's your accountant? Or you're a war veteran? Number 7 here is the hard one. That's the where's all the money? Where's the bank account? Which cookie jar? Which mattress did you hide the money under? On one of my trips out to the retiree chapters out in the West, I was watching whatever, it probably was JetBlue, and somehow I got stuck on a marathon of the show Storage Wars, where they go in and they buy the storage lockers and all. And one of them I remember, it was the 2 guys went in, and it was just junk. It was junk. They got all the way in the back, and there's this big picture with this fancy frame. And the picture is either like a Velvet Elvis or a dog shooting pool or something. So the picture wasn't anything anybody wanted, but they thought maybe they could get $5 for the frame. So they took it out in the hallway, tore the paper off the back of the picture, and taped to the back of the picture. There were 19 $100 bills. And so they were ecstatic because they paid like $200 for this locker. They got the $5 frame, they got $1,900, and it was like, oh, how wonderful. But me being who I am, I'm thinking of the family who abandoned the locker, who probably could have used the $1,900. So you got to let people know where the money is. If you have a safety deposit box, investment bankers, insurance, other people you need to contact. A reason why you would contact them. And now I just want to tell you a brief, I know everybody's had a long day. I don't want to be too long, but I want to tell you how this helps out. Now, I'll tell you a personal story, and I've told it before, so it's, nothing earth-shattering. If you've been to these before, I apologize. Maybe I'll say it differently this time. But after my father, my parents were both educators up on the coast of Maine. My father was a history teacher and then became the high school principal. My mother was a Latin teacher. So in my freshman year of high school, I had both my parents as teachers, and I got sent to the principal's office every night when I drove home with them. So my father had passed away, and my brother and I decided that we should go and celebrate my mother's birthday with her now since she was alone. Well, unfortunately, she was born in February. So we went up to Maine, both of us. I mean, he lived there and still does. I'm here in New York. And there's not a lot to do in Maine in February. You can watch the ice melt for just so long. So we're sitting in the living room watching a golf tournament from California. My mother comes into the living room with a piece of loose leaf notebook paper, and handwritten on it, the top of the sheet, it says, "What to do with my stuff." And it's like a ring that was her mother's, was to go to my cousin Caroline in Texas, and the whole deal. And it was like half a page. So we said, "Great, Mom, this is great, but you got to tell us where it's going to be." And she looked at me like I was from outer space and said, "It's going to be in the blue box in the desk, of course." And I'd forgotten that my father had a blue metal file box when I was growing up, and that's where all the important things like car insurance policies, life insurance policies, passbooks when you had a savings account and they actually took the bank in and they wrote in the deposit. It's also where he kept his private stash of chocolate bars. And he didn't know, my brother and I knew that's where they were. So every once in a while, he'd say, my mother said, "I don't remember eating all those chocolates. Would you get me some more?" And she'd say, "Sure." And we'd say under our breath, "Sure, go get more." So that was where it was. So several years later, she goes in the hospital for some surgery. And unfortunately, after a month in the hospital, passes away. So my brother calls me on the Saturday morning and said, "Doug, Mom passed away." And I said, "Okay." So we had a discussion and decided that because I was also getting my oldest daughter ready to for college, her first year of college, and because my mother was an educator, that she'd want us to get Chelsea to college. So we got Chelsea to college and then went to Maine. So in the meantime, that's my brother. What's he doing? He's making all the arrangements according to the information she provided. And when we get up there, we find out it's not a half a page anymore. It's 4 pages double-sided. And it's got a whole lot more information than who gets the ring. She's got on the instructions an order of worship for her memorial service, both with and without a choir. Because remember where she is. She's on the coast of Maine. And when do people on the coast of Maine make all the money that lets them live there all year? From May to October. Because that's when the tourists come and everybody wants to come and vacation in Maine. Nobody goes to Maine in February unless you're a skier, and that doesn't help on the coast. So she had a great concern that if she passed away in the summer, the church ladies wouldn't be able to get off from work and come sing in the choir. So it was with and without a choir. It was also helpful because 6 weeks before she passed away and 2 weeks before she went in the hospital, they got a new pastor. So the pastor didn't have any idea who my mother was, who'd been in the congregation for 60 years. So this was very useful. And all the instructions for the funeral director, the whole thing, everything was there. It even had all of the people where she had money invested. So when we had some time between the memorial service and the burial, we called these various companies. They sent a rep to the house the next day, and we did all the paperwork there. So while we were in Maine, we were able to get everything done. And so it was the best thing she ever did, was to have that put together for us with the instructions, with the contacts. It made it easier for my brother. He just had to go in and say, this is what you want, to wait for us. And then afterwards, we knew exactly who to call, what information it was, and it made it so much easier. So when we were cleaning out the house 3 or 4 years ago to sell it, were up there, and I actually found the blue metal file box again. And the list wasn't in it, but I found the property tax bill from 2001 and other things. And at one of the Thanksgivings, I mentioned to my brother that I talked about this, and he goes, yeah, I know. He says, I saw you. You told me about it. I watched the whole thing. It took me 2 hours to get to the part where you talked about it, and you only did it for 2 seconds. I said, yeah, right. He says, well, I just want you to know that I took the box home. I've got the box home, and I changed the combination. It's not the 000 that Dad had it on. I changed it so you couldn't get into it. And I said, great. What'd you change it to? And he goes, 001. So the point is that you need, it's very useful to have something like this put together, have it together. You can go online and buy a book, a full color glossy book for $20 that has the same information in it, or this. If you want to share this with other people, friends, neighbors, whatever, it's on our website under forms, booklets, and schedules for all funds. It's there for you to use. Let me just see if we got any questions here before we talk about benefits. Okay. If you didn't get the attachment, please email me and I'll email it to you. That's the only thing there so far. Okay, so let's go back. Now we get to the good stuff. Almost. If you're Medicare eligible now, meaning you're 65 and you're still working, or if your spouse or partner is 65 and covered by you as an active employee, hopefully all you've signed up for is, you or the partner has signed up for, is Medicare Part A. Medicare Part A covers hospitals and rehabilitation, like skilled nursing facilities. As long as you've paid into Social Security for 10 years, Medicare Part A is free. Medicare Part B is technically optional. That covers doctor visits, lab visits, and all. Medicare Part B is secondary if you also have coverage either as an active employee or as a dependent of an active employee. So if you're over 65 or going to be over 65 before you retire, please only sign up for Medicare Part A, don't sign up for B. Because Medicare B will be secondary to your city coverage, probably won't get much out of it because they're secondary. And as a result, you'd be throwing away $200, $300, $400 a month on something you're not using. So when you get ready to retire, and you will no longer be covered as an active employee, or when you retire and your spouse won't be covered anymore by you as an active employee, you need to enroll in Medicare Part B. And what they do is, there's a form here, the request for employment information. It gets certified by the DOE and shows when you started, when you ended your employment. And this gets you or your spouse partner into Medicare Part B with no penalty. If you wait and sign up for Medicare Part B at age 67 without this form, you're going to be paying 10% a year more than what you should, because they figured that you were healthy for 2 years, now you're sick, and it's time, and so they're going to make up for that and charge you a penalty. This form, the request for employment information, gets you into Medicare Part B whenever you retire with no penalty. So it's the employer name, an address, the city, they'll fill that out. They'll fill the DOE will fill everything out. They want you to email them this form and your TRS receipt, because the TRS receipt shows when you're retiring. They will not do this anymore. Just walk in and say, fill it out for me. They want proof of when you retired. So that's why TRS comes first. And especially if you're Medicare eligible or your partner is Medicare eligible, it's so critical to do this as early as possible to make sure that they have their 2 or 3 weeks to fill this out. And then you can get to Social Security. and then get everything arranged in time for your retirement date. If you have questions or problems doing this, you let us know and we can help you out. But I
So,
put it
I'm
in.
sorry, Doug. So just to clarify, if I am not Medicare eligible and
Right.
I retire, but my husband is Medicare eligible, does he still, is he still covered under my benefits, or would he have to pay for the Medicare B?
He has to pay for Medicare B, and then your benefits will become his Medicare supplement. But it's not as bad as it sounds, because back over 50 years ago, when Medicare was first introduced, the city went to the unions at the time and said, we can save a lot of money if retirees who are Medicare eligible are covered by Medicare primary and we become the secondary. And the unions, to their credit, said, yes, you're right. We'll agree to this as long as you reimburse the retiree for whatever they pay for Medicare. At the time, it was only Medicare Part B. So the standard amount everybody pays, you get automatically every year. Once you get a Medicare card, you send it to us, we'll send it on to the city, and then from that time on, every April, you get reimbursed for the previous year, whatever the standard amount everybody pays. In 2021, that's $148.50. Then, per person.
I'm sorry. So once we're both 65,
Right.
then clearly we're paying for the B again, and we're getting reimbursed for that?
Yeah, you're getting reimbursed for that. There's two parts of Medicare Part B that you'll pay for. The standard amount is what everybody pays for.
Mm-hmm.
And then there's what they call IRMA, our income-related Medicare adjustment amount,
Right.
which based upon income is extra. So what the city does is say, okay, you know, in April of, I'll use this year as an example. In April of 2021, all who were covered by Medicare for 2020 will get reimbursed, the standard amount. Then if you paid more in 2020, which is the IRMA, you have to file for that. So you send them paperwork, and then starting in October of 21, they'll reimburse the IRMA. We will guide you through that process. We'll send you the form. We will review the forms to make sure you got them right, and then submit to the city for you so that if they lose it, we can give it to them electronically again.
And that's in October. The standard is in April, the other one is in October. Okay.
Right, right. Yep.
So basically what you're saying is that the hospital is free, and when we're 65 and over, we're paying for the Part B, both standard and IRMA, but we are going to be reimbursed for that.
Absolutely. Yep.
Okay. Thank you.
There will be a small amount for D, which is for the drugs. So even though your Part D drug plan is through the city, you still have to pay the extra to Medicare to help pay for the drugs. And that's not reimbursable because that's a new thing. And the city it's typically, I haven't seen it be more than like $50. And if it's $50, you've got an income over $750,000 a year. So easy for me to say you can afford the $50. So that's what we look like here. So now, let me just stop the share here. So if you got any more questions. Minimum number of days to provide notification to your employer. If you are school-based, you need 90 days written notice. If you're not school-based, you don't have to give them any notice. You can just say, I'm retiring tomorrow, and walk out the door. I probably should give them some notice, but and the number of days is only the main effect of that is when do they pay you out for any unused vacation time you've got in the car bank. You get paid out 1 day for every 2 that you have. And if you don't give 90 days notice, they've got up to 2 years to pay you out. If you give notice, then you can get it within a couple of months usually. So that would be the big difference there.
Doug, I have a question. Can any of these days from your car be applied to earlier retirement or leaving earlier?
You can, with approval, you can use the car days instead of getting paid out in the terminal leave. But you would have to talk to the superintendent, I think, to find out exactly. I get confused over the parameters of when you can do it and when you can't. Usually they like it to begin at the beginning of a semester and be used all up within one semester. So, February to June or September to December. If it's
And just to clarify, with EAs or other non-school based folks, it's half your car days up to half of 200 and 2 years worth of annual leave without a letter, and with a letter they'll go up to 3.
Oh, okay, thank you. See, now I learned something. Now I know I'm tired. It took me this long to learn something new. I tell my staff they should learn something new every day. And then I say, well, you should learn it as early as possible. Because then you can coast for the rest of the day. Got another question here. Yeah, as far as I know, the only issue if you retire within the 2 months is the holding of the car days. As long as you get the paperwork done, that you can still retire. You'll be okay. So let's talk about some benefits.
And Doug, just a quick question. How long is it between when you come off payroll before your pension kicks in, and what determines the amount of your pension?
Well, what determines the amount of pension is probably your work experience and your salary. You'd have to ask the pension consultant that. If you retire mid-year, they usually get it calculated and finalized within a month or so. If you retire in the summer, it can take 2 or 3 months, just because of the volume, because that's when all the teachers retire as well. And if you're an EA, sometimes it takes even longer, because with all the various, we're going to be districts, or we're going to be regions, or we're going to be whatever we are, the paperwork is God knows where. And you'd think it would all be on a computer system somewhere, but they seem to have trouble tracking it all down. So sometimes with EAs, it takes a little longer. What TRS will do is they'll have a ballpark estimate of what your pension will be, and they'll give you about 80% of that, like when you first retire. When it's finalized, they'll give you the full amount of the pension, plus they'll give you all that 20% or so that they didn't give you before. And if it's been over, I forget how many months, either 3 or 6 months or more, you get interest on the back amount that they should have paid you. So at the end of the day, you will be made completely whole.
The other problem with EAs is that there's nothing like electronic. It's all entered by hand. So.
Well, yeah. So I know it takes a long while, and I've heard some horror stories of where those records are.
But we can expect to get something within a few.
Oh yeah, no. For the last probably 18, 20 years since I've been around CSA, they've done an estimated. It's my understanding that back before then, there was no estimate. You just waited until they finalized it, but it was taking them so long that everybody complained. So they found out a way to do an estimated amount, a partial reimbursement, and then make you whole once they've had a chance to calculate everything. Okay, let me just see any more questions here. Oh, there's a question. Jorge, email me your question specifically. I'll go to the union, get an answer for it. I don't want to mislead you here, okay, Mr. Gonzalez?
Yeah, thank you, Douglas.
Okay, you know, even if we were doing this at 4 o'clock in the morning, I wouldn't attempt to answer that one, so.
Understand. Okay.
I don't want to lie to you. You're
All
too
right,
nice a guy.
All right, cool. Thank you.
Yeah. Okay, so we've got benefits here. And like the last 2 pages of the handout. The light green column is what you get as a member of the Retiree Welfare Fund. These are benefits that come to you free of charge. As long as you retire, as long as you're in the active fund, now you're in the retiree fund, you do not pay anything for access to these. We get a contribution every month from the Department of Education, and we use that for a variety of things, primarily for reimbursing here. The retiree chapter dues that we talked about, a portion of them go for what's in the pink column. And the way it works is, if there's something that the welfare fund pays and the chapter provides a supplement for, the reimbursement will come automatically. So let's, yeah, I'll show you an example in a second, because I like to stay in order, because otherwise I won't remember everything. Oh, screw it, let's do optical. Optical is a good example, okay? We continue with the benefit of $100 towards glasses or contacts every year. And that comes direct to you. Now, the beauty of being newly retired is if you have a voucher in, say, June, and then you retire July 1st, in July you can get another voucher because you've never had one as a retiree. They're 2 separate funds, 2 separate eligibilities, 2 separate sets of benefits. So you have the voucher as an active member in June. You decide when you retire, you want a pair of prescription sunglasses or another supply of contacts, you can go in, ask for a voucher. We'll see that you've never had one yet as a retiree, and we'll be able to go in and do the voucher. So as soon as we process that reimbursement for you for your voucher, if you paid over $100, then we automatically know at the end of the month to send you up to $65 from the retiree chapter. So you get the chapter reimbursement, but it's not like, well, you just got a check from the welfare fund, now you have to send paperwork back. It's all done, you know, seamlessly. Everything's on our system, everything's in our server, everything's securely together. So it's not like your health information's floating around the office, it's just in our little corner, and it's all on our server that we can lock off if we have to. So it happens transparently. Typically, whatever month you get an optical from the welfare fund, you then will get the chapter supplement at the end of that month. Going back to the top here for dental, we improved the dental choices for you. From active, as an active member, you have 2 choices. You have the DentCare or HealthPlex HMO, and you have SIDS. When you retiree, you have both of those choices. If you're in Florida, you can get a discount plan offered through HealthFlex DentCare. Or in some places, we have a Delta Dental HMO, California, Arizona, Florida, Georgia, New Jersey. It's there. More importantly, the SIDS plan gets better as a retiree. Right now, if you go to a participating provider, there's a deductible. There's $25 deductible. There's also a $50 copay on crowns and bridges and things like that. All copays and deductibles go away when you're a retiree. But more importantly, we have an expanded network we've had for the last couple of years. In Greater New York, SIDS is licensed access to a group called MetroDent, which provides significant discounts off of the list price of the dental services. And everywhere in the country, we subscribe to a network called Carrington. There's about 100 to 110,000 dentists around the country. And they accept our payment as the bulk of what they charge, and they charge a greatly reduced fee. I was corresponding with somebody yesterday that active member, they were going to be paying $1,500 for a crown. our retiree reimbursement for a crown is $500. So if you pay $1,500 for a crown, we'll give you back $500. You're still out of pocket $1,000. If you go to a Carrington dentist, their fee for that crown is $765. We're going to pay the same $500, so your out of pocket will be $265 instead of $1,000. So if you want to see who's available for retiree participating dentists, if you go to the SIDS website, which is asonet.com, from the drop-down, say that you're part of the CSA Retiree Welfare Fund, go in and do a provider search, and you'll see all the providers. They'll be color-coded. The blue ones are our traditional SIDS dentists, the green are Metro Dent, and the red are Carrington. So, and we did that so that no matter where you are in the country, you can get significant savings off your dental costs, which tend to go up a bit as we retire. We also, as a retiree in SIDS, we have limited support for implants. We'll provide $600 towards an implant, provide $237 for the abutment, $437 for the crown, with a maximum of $3,000 over a 36-month period. So if you use $1,000 in the first month, by the time you get to month 37, we only look back 36, so you got that $1,000 available again. We're one of the very few funds in the city, if not the only one, that provides anything towards implants. So that's the dental.
I'm sorry, Doug, just, would the right thing be to reach out to you? I'm trying to find a participating endodontist now. I've been avoiding work, and there's like 3 within the 5 boroughs, and what they're requiring in order to see me is ridiculous. Would that?
Yeah, show me an email and we'll see. We'll talk about it.
Thank you.
Yeah. Okay, let me see. This is where we usually get questions, so let me stop here. Oh, that's just a thank you. Okay. We like thank yous. Okay, continue with the optical. But there's other things available now other than just glasses or contacts. If you develop eye problems like macular degeneration and you need a vision aid machine, we'll pay $500 once in a lifetime towards that. In the past, they were like the old style CRT screens. You put the page underneath it and it magnified it so you could see. Laser vision, we continue laser vision. If you want to have LASIK surgery, we'll pay you $500 once in a lifetime. So again, we have the same benefit as for the active fund. So if you can find a cooperating eye surgeon, just before you retire, have one eye done, get a voucher and get the $500, have the other one done after you retire, you got $1,000. Eye surgeons will probably have heart attacks if you mention that to them, but it's fun to watch them react to that. But we do continue this $500 if you want to have the LASIK surgery. The latest and greatest optical technology is what they call a multifocal lens if you have cataract surgery. Up until a few years ago, Medicare wouldn't pay anything towards this. They consider it experimental. They will now pay the equivalent of having a single vision lens, which they've been doing for 30 years. There's still out-of-pocket costs of $1,000 to $1,500 per eye. If you get these, they're advertised as being like bifocal replacement lenses so that you don't have to wear glasses at all. Typically with cataracts, you have distance glasses or reading glasses maybe. With this, they claim you don't need any. We'll do $500 per eye once in a lifetime because really it can only be done once. We don't pay anything towards using a laser for cataract surgery yet. We've thought about that, but we haven't implemented that. So right now, the only cataract benefit is the $500 per eye for the multifocal, or what they are sometimes called toric, T-O-R-I-C lenses. We continue our hearing aid benefit. We increased that a few years ago up to $800. The retiree chapter will also provide $800. Again, just like the optical, you go in, we send you a voucher. We'll give you the $800. At the end of the month, after we pay you, you will then get the retiree chapter check for up to $800. We don't do many active hearing aids for active members, but we do a lot for retirees. And being a data-driven person, I finally figured out why. It was, if you're an active person and you were back in the days when you were in the school, if you couldn't hear things, that was a good thing. But when you get to be retired, you can't hear your grandkids, that's a bad thing. So it's nothing to do with getting older or anything. It's just you want to hear the grandkids. So a total of $1,600. Hearing aids are very expensive. Not a plug, but if you go to Costco, $1,600 will pretty much pay for a pair of hearing aids. Their upgraded hearing aids are about $2,500. Some of the other brand names, if you go to an independent store, can be $5,000 or $6,000. So hearing aids are quite expensive. We have a home health aid benefit that we don't have for you as an active member. There may come a time when you need help around the house, either for yourself or for a spouse or partner. I spoke to a gentleman today whose wife was in Sloan Kettering, going to be coming home soon after major surgery and will be weak, and he needs help getting her like to the toilet, to the bathroom, to clean up or whatever. And so we will provide reimbursement for up to $10,000 a year, $30,000 lifetime, for you to have a licensed home health aide. The retiree chapter kicks in 20%. So in this case, that's another $2,000. So there's $12,000 available for a home health aide. We have a claim form for that. Just a place for the doctor to certify. What we require is you get the treatment, the care from either a personally licensed aide or from a state licensed agency. And we want to see proof of payment made to the agency or to the aide. I can't reimburse cash receipts. And if it's the kid next door who's taking care of you, that's great. I applaud you for helping the young kids, but I can't reimburse anything because they're not certified. We do that not to be a pain, but because we want to make sure that you have proper care. So if someone is trained and has a license, there's something at stake. If it's an agency, the people they send, they're responsible for. You quite often will see in the paper or on news where some elderly person has had their life savings wiped out because they trusted the kid next door to come in and take care of them and pay their bills. And so the person didn't read what was on the check. The check was either blank or made out to the aide, cleaned out the bank account, and now there's no recourse because it's just the kid next door. If it's an aide or an agency, you have legal remedies available, so it protects you.
I'm sorry, Doug, that is per person, right?
Per person, right, yes. For you
and a spouse.
You and a spouse, yes.
Thank you.
We've increased it several times. We're probably due to increase it again maybe next year. We usually bump it up by $2,000. So if somebody's used up all, at this point, $30,000 worth of benefits, and now we say we're going to make it $12,000 a year, $36,000 lifetime, there's $6,000 more reimbursement available for that person. So you may be at the lifetime maximum, but if we increase the lifetime maximum, then there's more benefit available. We started out at $4,000 a year back in 2005. So in 15 years, we've increased it quite a bit. We talked about this next one, the copay for prescription drugs. When you retire, Assuming your GHI or HIP, you'll get reports from Express Scripts on a quarterly basis. We ask you to save those up, and at the end of the year, send us copies. You know, we don't trust the post office even in good years now, especially not, because they'll lose it. And if you lose it, good luck getting another one from Express Scripts. We, at the same time, send files to the GHI. We have an arrangement with them where we provide them a list of our people who are in their drug plans. They send us electronically the prescription information. So as a result, when we get your information, we just key it into the system once we've cleaned up the data, and we can spit out the claim for the welfare fund and also the retiree chapter check. We used to pay a group of retired ladies about 20 grand a year to come in and do this. We could do it now in a day or two with the system. And so this is available. Oh, I missed the stop loss, sorry. The stop loss benefit continues. We have it as an active member. As an active member, if you go to a non-participating provider and you run up over $1,500 of unreimbursed expenses, we pay the next $1,250 at 80%. Then we pay 100% to a maximum of $50,000 a year with $250,000 lifetime per person maximum. That goes away if you've used any catastrophic benefits as an active member, because now you're a retiree. You've never used retiree benefits, so you get that $250,000 back. This time, as a retiree, the deductible is only $1,000. So after $1,000 of unreimbursed expenses, the next $1,250 we reimburse at 80%, and then at 100%. Where this comes in handy is if you are not yet Medicare and you leave Greater New York, you will not probably find a GHI participating provider. GHI will pay something, a minimal amount. You go to the doctor for a checkup, they bill you $300. If it's a general practitioner, you may get back $39. So $39 out of $300 leaves $261 of unreimbursed expenses. That $261 counts towards the $1,000 deductible. So after 4 or 5 doctor visits, you're now at the point where we can help you reimburse those costs. So at $1,250 plus the cost of the pension deduction, GHI still makes sense if you leave Greater New York. Once you get to be Medicare eligible, as long as Medicare pays, GHI pays. There's a small deductible for each. This year it's, I think, $203 for Medicare and $50 for GHI. So basically $250 out of pocket at the beginning of the year, and then you're home free for the rest of the year. So we did the copays. If you're GHI eligible, Medicare, you're in the GHI drug plan, we send you one person in the family $40 a month at the end of the year, like similar to what the Medicare reimbursements are. And if you exceed the out-of-pocket maximum, which this year is $6,550, then we can reimburse up to $5,000. So we do the $480 instead. So let me just stop here for a second before I go to page 2. See if we've got any questions. There are a couple. Is there anything additional for the 55-25? Not that I'm aware of. It just get to be 55. But if you drop me an email, I'll double check and make sure that there's nothing else involved. That was a big topic at one point. I haven't dealt with it as much recently. Page 2, this is where it gets fun. Our supplemental medical program is greatly enhanced from what it is for actives. Since we're not providing the prescription drug benefit, we have a lot more available here. Under supplemental medical, anything in here, or pretty much everything in here, we reimburse 80% after a $100 deductible. So And once you pay the $100 annual deductible, it's annual, so it's not every claim, it's just once. So what do we cover? We cover if you have surgery or anesthesia. If it's big ticket, then it gets catastrophic. But if it's a dermatological procedure maybe, or minor surgery, GHI pays whatever. We take our $100 deductible, we'll give you back 80%. When you get to, and whatever we don't pay, the 20% we don't pay, goes to counts towards your catastrophic deductible. The next one here, diagnostic invasive procedures, is a euphemism for the colonoscopies and bronchoscopies and endoscopies. I used to give this as a test. I give the survivor guide as an assignment. I would give an assignment here and say, give me something good that ends in oscopy, because I'm giving you colonoscopy and bronchoscopy and endoscopy. So give me something good that ends in oscopy. So I made the comment to a retiree presentation in the office one time, and a couple of weeks later, a retiree up in Rockland County sent me a paper, some papers he was going to send. And with it, he had an ad he cut out from like the Penny Saver or the Hometown Shopper or whatever, the local, advertising thing. And it was an ad for the local chimney sweep, who was offering a free chimnoscopy if you gave him a call. And his little sticky note on it was, is this something good that ends in oscopy? So I had to agree with him that yes, a chimnoscopy was something good that ended in oscopy. So I'm still looking for something else. The point is, pre-Medicare, there may be some out-of-pocket costs associated with this. We reimburse 80% of those costs. Private duty nursing, we talked about the home health aid benefit. That's one level of care. If you need a higher level of care, if you need a nurse, and GHI, Medicare may not be paying for that, then we can reimburse up to $10,000 a year. The chapter will kick in 20% or to make it 12,000, and there is no lifetime maximum on the private duty nursing benefit. One place where we often see this is with people, Medicare eligibles, who are in the hospital, and part of the discharge care is that they get IV antibiotics 3 times a day for 10 days. Well, if you go to the hospital for 10 days and get it in the hospital or an IV center, then Medicare will pay. But if you're not strong enough to do that for 10 days and you want it done at home, Medicare won't pay anything. So we can work, we've worked with several local nursing agencies where they will give us the real rate, not the insurance rate. They'll bill us, we'll pay them, you'll pay the 20%. The cost of the medication goes to the prescription plan, so you can get, or you or your spouse or partner can get the needed care at home rather than having to schlep over to the hospital all the time. Radiation chemotherapy, sometimes there are facility charges and things like that. Supply charges, we don't cover the drugs, that's covered by either the medical or the prescription plan. Next benefit is a transportation benefit. Sometimes, for whatever reason, an emergency ambulance isn't fully covered by Medicare, GHI, or whoever. We'll pick up 80% of that. Non-emergency ambulance or ambulance service going back and forth to the doctor, that's never covered by anybody. So we will reimburse up to $2,500 a year for non-emergency ambulance or ambulance. You go from a hospital to a rehab center by ambulance, that's non-emergency, you're paying the bill, we'll pick up 80% of that. Next one is wigs. Nobody pays for a wig. If you're undergoing chemotherapy and lose your hair or develop alopecia and want a wig, we reimburse up to $1,000 a year for wigs. Surgical stockings, removable portable toilet seats, all the fun things as we get older. We continue to, we'll provide some reimbursement for those. Orthotics, We continue the orthotic reimbursement. We do that now for you as an active member. So if you are prescribed custom orthotics, not Dr. Scholl's, but custom orthotics, as an active member, we'll reimburse 80% after $150 deductible, up to $400 per pair, and we'll reimburse for 2 pair a year. When you get to be a retiree, it's the same deal, but it's only $100 deductible. So if you need those custom orthotics, we will provide some reimbursement for that. In order to reimburse you, we need a copy of the doctor's prescription and an itemized receipt from the people that made the orthotic so that we know it really was a custom orthotic. Next one here is a therapy benefit. It used to be that Medicare counted visits for physical therapy. We used to be allowed to reimburse up to 20, supplement up to 20, but Medicare changed several years back to a dollar amount. So by the time you met their dollar amount, you'd be at 22 or 23 visits. There was nothing for us to reimburse. So back there in 2015, we went in and had the trustees approve a reimbursement for physical therapy, and then also to expand it to include speech therapy and occupational therapy, thinking that, for example, if you have a stroke, the physical part of walking may be important, but then you may also need help feeding yourself or learning to write your name or correspond again, which is considered occupational therapy, or learning to talk, which would be speech therapy. We also provide some limited benefits here for mental health counseling. Medicare just started providing some counseling benefit, so we've included that here. The newest benefit we added, which was 2 or 3 years ago, was an acupuncture benefit, and we did this by member request. And we implemented thinking that if we could provide pain relief some way other than using opioid drugs, it would be a good thing. So originally it was 18 visits. A couple of years ago, we increased it to 36 visits a year, but made it an allowable charge of $100. So we'll reimburse up to 36 visits a year. The allowable charge will be $100, so after any deductible, we'll give you back 80%. The retiree chapter will reimburse 20% of that. So for every $100 you spend, you get $96 back. What we would need to see initially is a copy of the provider's license, or make sure the license number is on the receipt. And we'd want to see an itemized receipt showing the charge and the code and the services they provided. I'm allergic to myself. We also reimburse the $300 hospital deductible. If you're in the GHI Blue Cross plan, you have a $300 hospital deductible. We will reimburse that at 80%. If you're in HIP, thank you for staying with me, because everything I just talked about is going to be covered by HIP. So for HIP only, we reimburse your doctor copays. So after $100 worth of doctor copays, we'll reimburse 80% of your copays. The extended hospitalization I talked about. For those in GHI, in Medicare, when you look at the pension deduction chart, there's the drugs and then there's rider other for $1. What that does is that extends Medicare's hospital coverage to 360 days. Medicare provides, after a $1,100 or $1,300 deductible, they will then provide up to 120 days of coverage in full and no cost to you. Then they would extend, you start paying a percentage of the cost to 180 days. After 180 days, it would be all yours. So the Medicare supplement from the city, the Blue Cross part that supplements the hospital, provides a full 365 days at no cost to you. Like I said, the welfare fund picks that up so that if down the road, when you're Medicare eligible, you take one generic blood pressure pill and you don't want to spend $150 a month for that, you can go find a different prescription drug plan that meets the Medicare Part D requirements that will cost you less, but you won't lose the hospital coverage. When that time comes, you just give us a call or drop us an email and we can help you fill that out. And we talked about the survivor benefits. Those you leave behind are entitled to welfare fund benefits free of charge for 5 years. So everything in the green column is free of charge to your spouse or partner if you predecease them. After that, they can buy into it and keep it going as long as they want to. We call it Cobra for life. And like I said, the rate goes up and down. This year it went down, so it's $65.05 a month. So for $780, you can get $800 towards a hearing aid, which is a pretty good deal. So these are our benefits. And like I said, anything in the green column is yours free of charge for you and your eligible dependents. Should you join the retiree chapter, which is what we encourage, then those that are in the pink column will come to you by paying your dues. And I think I said everything I wanted to say. I can help you find any forms you want. If they're in the materials. If you need them individually, just drop me an email. I'll be happy to email them over to you. I've got them all available. I thank you. Thank you for your time. And if you have any questions, ask away. If you have any individual questions that you're not ashamed to ask a friend of others, ask away. If you're embarrassed by the question, send me an email and we'll be able to answer them for you. And I thank you for your time, and God bless you with what you're going through and what you're doing. I'm envious. I don't know how you do it, and for whatever we can do, remember we're here to support you.
Thank you.
Thank you so much, Doug.
My pleasure.
Take care.
Thank
You too.
Thank you, sir. Thank you. Very enlightening. Thank you, sir.
Good. I'm glad you got something out of it.
All right.
Thank you, Doug. We appreciate
Okay.
your time. Thank you.
My pleasure.
Thank you,
Thanks,
Doug.
Dr. Hathaway.
Yeah.
You all have a great night now. Bye-bye.
You too.
Thank you so much, Doug. You're always right there